In the interest of public health and safety and pursuant to the Governor Executive Order N2920, members of the Healthy Chula Vista Advisory Commission and staff are participating in this meeting by teleconference. In accordance with the executive order, the public may view this meeting online and not in the council chambers. The city launched a virtual commenting portal, e-comment, that allows residents to comment and participate in the meeting from their own homes. You can find the link to the e-comment at www.chulavista.gov/boards. Your comments may be received before I call for the close of the commenting period in order to be considered. After the commenting period is closed, I will announce a brief pause to allow the commissioners time to read any comments that have been received. If you have difficulty or need assistance with e-comment during the meeting, please email Patricia Salvacion for assistance at psalvacion@chulavista.gov. Would the secretary please call the roll?
Yes. Commissioners Cruz?
Here.
Commissioner Del Murguia?
Here.
Commissioner Hernandez Nader?
Present.
Commissioner Martinez?
Here.
Commissioner Melgoza?
Commissioner Melgoza is absent.
Okay. Commissioner Murphy?
Here.
Commissioner Rodriguez?
Present.
And Commissioner Partida Lopez and Commissioner Quiros have requested excused absences.
Actually, Commissioner Quiros may be joining us here in a few minutes.
Thank you.
All right, so the first order of business is to welcome our new city manager, Maria Kachadorian. Did I pronounce that right?
Close enough.
Welcome.
Thank you. So I don't want to take a lot of your time. I know you have a long agenda. So I really want to take the time just to introduce myself. I know a lot of you already, but I am trying to reach out to every board and commissions. I wish I could do it in person. There's something that we miss by having to do it this way. But for now, this is the best I can do, and really just taking the opportunity to let you know, that I'm very committed to the work that you are doing. Of course, with the current COVID crisis, my mom used to say, nothing matters without your health. And so what you're doing is the top priority for us right now with the COVID situation. But just to give you a little bit of background of who I am, I'm a South Bay resident. I grew up in Imperial Beach. I've been working here in the city of Chula Vista for about 22 years. Yes, I'm getting old. I might have to go to the Aging Commission next year. Yeah, I'm very committed to this community. I know it really well. We raised our two daughters here. Both of them went to East Lake High School. Both are not college graduates, but the majority of the time I've been with the city, I was the finance director. So I led the city through the Great Recession. And then Gary Halbert promoted me to deputy city manager, then assistant city manager. So my experience really broadened to really working on major projects citywide. A lot of the projects we're working on right now, a lot of people ask me, is the Bayfront still happening? Is the university still happening? Is the development, still happening with housing? Everything that we had going on before COVID hit is still happening. We're still working on all of that. But of course, now we're layering on top of this, trying to manage through this crisis. So we've been working very hard over the last several months. And I think Marlon is on today, right, for your agenda to go over. So he has all the information in terms of what we've been doing and really the focus that we've had over the last several months to try to do what we can to help the community, try to keep us all safe as much as we can. So we are going to be entering into a partnership with the County of San Diego to participate in testing and tracing. So we're shifting some of the work staff that we had to try to put more focus in on the west side of town, because that's where the numbers are the most problematic. So I'm committed to continue to do the work that we were doing before and continuing to do the work that we're now doing because of the COVID crisis. So again, I wish I could do this in person, but I'm just here to really introduce myself and let you know that I'm here. open door policy, but no one can come in right now. So this is the best we can do. And I hope that someday we'll be able to meet in person and really have a conversation with you, because I like to actually even learn more about what you're working on and what your concerns are. So I will leave now because I have like 2 other meetings to run up to, but I did want to take this opportunity and thank Stacy for all the work that she's been doing in this area. She's very committed, and you're in good hands. Thank you.
Thank you, Maria.
Thank you. Bye-bye.
Bye. All right, for our next presentation, we would like to welcome our newest members of the commission. So we have new commission members, Elizabeth Murphy.
I'm here. Hello,
hi,
everybody.
Liz. Okay.
So Lucia,
then,
just in case everybody wants to see each other, I forgot to mention this early on, but on the top right corner of the WebEx, there should be, if you scroll over it, there's one that says floating panel view. And then just to the left of that, there's one that says either grid view or active speaker view. But there's 4 little boxes. And if you click on the 4 boxes, you'll see everybody on your screen.
Thank you. Okay, we also have Frida Hernandez Nader. Did I pronounce your name right? Is it Frida or Freda?
My name is Freda. Everyone calls me Frida, and I'm okay with that. It's really good to be with you all, and I'm really excited to get to work. Thanks.
Welcome. And then Dr. Alan Rodriguez. I saw him on the camera earlier.
He was on camera earlier, so I don't know if he may have had to step away. It looked like he was at work, so he may have had to step away for a second. I'm not sure, but hopefully he'll be right back with us.
Okay, and I did notice that Commissioner Quitos joined us, so welcome. I will now call for a 2-minute pause to allow the public to submit any final comments on items on presentations 1 and 2, meaning the new city manager, and our new commissioners. As a reminder, please refresh the view on your screen to ensure new comments appear.
Will staff please display the public comment and start the timer?
I just wanted to make sure that's up, Patricia. Can somebody give me a thumbs
Yes,
up if
thank
they
you.
see the timer?
Thank
Okay,
you.
thank you.
Yes, thank you.
All right, so the commenting period for the public comments is now closed. Have the commissioners had enough time to read? We actually didn't have any comments. I didn't see any come through, at least on my end. Did I miss anything?
No comments were received.
Okay. Our next order of business is the consent calendar. I will now call for a 2-minute pause to allow the public to submit any final comments on the consent calendar. Commissioners, as a reminder, please press view on your screen to ensure new comments appear.
Will staff please display the public comment and start the timer? Thank you.
All right, the commenting period for the consent calendar is now closed. I don't believe we received any comments on this one either.
No comments were received. Thank you.
Okay. Do any commissioners wish to pull an item for discussion or questions? Nope. Okay, so item number 3 is the approval of minutes from February 3rd, 2020. Recommended action, review attachment 1 and approve minutes. Is there a motion to approve the items on the consent calendar?
I will make that motion.
Thank you, Commissioner De Murguia. Is there a second motion?
I'll go ahead and second it.
Thank you, Commissioner Quiro.
I will now request each member's vote by roll call, please. Commissioner Cruz, Commissioner De Murguia, Commissioner Hernandez-Nader,
Aye.
Commissioner Martinez,
Aye.
Commissioner Murphy,
Aye.
Commissioner Quiros,
Aye.
and Commissioner Rodriguez.
I just wanted to double check if Commissioners Cruz or Rodriguez, you are both muted if you did respond.
I said yes.
Okay, thank you. And Commissioner Rodriguez? I'll send him a message separately because it seems like we may have lost him.
Can I move forward with the passing, or do we have to wait for that and come back to it?
No, that's fine. I'll just mark him as an abstention.
Okay, so approval of the consent calendar passes. I didn't count how many there were, but I think there was one abstention. I don't remember how many of us are on here.
It should be 7 total, so there'll be a 6-0-1 vote.
Okay, thank you. 601 votes. Patricia, I think it's you.
Thank you. So will staff please display the public comment and start the timer?
All right. So the commenting period for the public comments is now closed, and I don't believe we had any come through again.
We did not receive any comments for under public comments. Thank you.
Thank you. All right, so we're going to be moving on to the action items. The next item on the agenda is item number 4, election of chair and vice chair. I think we said we might move on from this one until everyone is available. Is that correct, Stacy, or should we continue with this action item?
That would be up to the commission, so you can vote to table it if you choose to, or if you'd like to vote on chair and vice chair today, you may do so. You are missing, you're missing 3 members currently, including Commissioner Rodriguez.
I move to table item 4.
I would
Anybody
second
else?
that.
Okay. Thank you, Commissioner Hernandez-Nader and de Murguia. So we will move to table this for the next meeting. Do I need to have a 2-minute comment section for this one as well, if we're tabling it, or can we move forward?
No, I think you can move forward on this one.
Okay, thank you. Okay, sorry, I'm just scrolling here. All right, so action number 5, annual activities report for fiscal year 2019-2020. So recommended action, commissioners review attachment 2 and provide a recommended on approval. Is there a motion to accept the 2019-2020 annual report?
That motion.
So I have a motion by Commissioner de Murguia. And second
This is Mary. Can you hear me?
Yes. Hi, Mary.
Hi. Second?
Thank you. And I have a second by Commissioner Cruz.
Okay, now I will request each member's vote by roll call, please. Commissioner Cruz,
Yes.
Commissioner De Murguia,
Yes.
Commissioner Hernandez-Nader,
Aye.
Commissioner Martinez,
Aye.
Commissioner Murphy,
Aye.
Commissioner Quiros,
Aye.
and Commissioner Rodriguez. Thank you.
All right, so the next item on the agenda is item number 6, COVID-19 county update. Staff, can you please share the presentation and introduce our speaker?
Yes, with us today is our Health and Human Services County Representative, Barbara Jimenez, who runs the Central and South regions for the Live Well efforts. And Barbara, if I did not get any of that correct, please do correct me. I'm going to pull up your presentation here for you. And Barbara's here today to provide us with a presentation on the county's response to the COVID-19 pandemic.
Thank you, Stacy. Thumbs up, you can hear me okay?
Yes, and can you guys see the
Perfect.
slide presentation as well?
Yes, I can see it.
Perfect.
Okay, so thank you so much. It's so wonderful to, see you guys in action in terms of how this all works is really amazing, but also a lot of familiar faces and some familiar names. So thank you so much for having me. For those I haven't met, my name is Barbara Jimenez. I'm the Director of Regional Operations with the County of San Diego Health and Human Services Agency, and specifically with oversight in the Central and South regions. I have been deployed to manage the COVID-19 efforts since about March, and I'm currently serving also as what we call the sector lead for cities, government, tribal nations, and binational affairs. And then I'm also helping Nick Mascione, who's our director of our agency, who's running the T3 efforts that I'll talk a little bit more about. And so I've been assisting specifically in the South, Central, and South regions. Next slide, Stacey. So I'm going to give you some updated numbers. These numbers were current when we send them over, but we just had a press briefing at 2:30. So I'm going to just talk to you a little bit about our current situation. We currently, as of today's briefing, so as of yesterday's number, we have 33,659 cases that are positive for COVID-19, and unfortunately 615 deaths. The breakdown here in terms of some of the percentages is a little bit off based on today's numbers, but fairly accurate in terms of the male and female. One of the things that I'm sure many of you have heard, in particular in Chula Vista and in South Bay, is just our overall concern with the severe impact and the more impact on our Latino Hispanic population, as well as our African American community and our Asian Pacific Islander. With our Latino and Hispanic, over 60% of the people who've tested positive for COVID are Hispanic, and in comparison, our population in the entire county, Latinos, Hispanics make up 34% of the population. So there's a huge disparate number there. And then our Hispanic or Latinos represent over 45% of the deaths. Next slide. I mentioned the T3 strategy and the efforts that Nick Mascione, our agency director, has been leading. And so I'm just going to talk a little bit about each of these. And the first one is testing, and I'll go into a little bit more detail as we go forward. But I think the key thing with testing is just making sure that it's accessible. So when Nick went over to run the T3, we were really struggling as a county, and we weren't the only county, but we were really struggling with just being able to have, to get enough tests out there and to make them accessible. So really have put a lot of effort into increasing the number of tests, the locations of the tests, definitely through the leadership of the South region leaders have increased the number of testing sites in the South County. But really have been looking at the different ways that we could provide testing across the entire county, whether it's a drive up, whether it's a walk up, whether you're here a little bit more. We'll talk a little bit about the no appointments, but when we started, it was all appointments. And we have both county run testing sites and we have state sites. Now this, of course, and when we talk about the numbers of tests that are done, is one fraction of the entire population or the entire number of tests, because our hospitals are running tests, our clinics are running tests, there's private labs running tests. So there's lots of different folks contributing to that overall effort, but definitely that number has increased. And the role of the county and Health and Human Services Agency is oftentimes trying to ensure that we can work with partners and providers and fill in any gaps or work to help identify where those gaps might be and help support. Tracing is really about what happens after you take the test. So first there was, making sure tests were available. Now people are getting their tests. So what happens after you get the test? We have sort of different levels, one being the case investigation, which is usually one of our public health nurses. Our investigators are going to really dive deep into first the notification that you're positive, and then asking you those questions to help determine who are your close contacts. And then from there, we go into the contact tracers. So they're different roles, and I know sometimes they're kind of lumped into one, but our contact tracers really then follow the close contacts, people who have been close contact. And when we talk about a close contact, that means it's someone who spent at least 15 minutes with a positive COVID-19 case person within 6 feet. So they were not maintaining that social distance. And it doesn't matter if they were or not wearing the face mask or the face covering. So the tracers, the contact tracers are going to talk with those close contacts. They will not share who was that positive. They won't share how they got the information. It's more about education, information, making sure the person's okay, and then helping to educate around isolation and some of those other efforts. And then kind of an additional layer, and the new city manager, Maria just mentioned it, was the effort around expanding contact tracing. And in particular, a couple of the efforts we have going on in the community, in the county, revolve around promotores or community health workers, and really leveraging the relationships that they have in the communities to help maybe get the information and connect with people who maybe haven't answered the phone, are concerned about responding to a call from the county, and or need a little bit more connection to some of those resources that are available. And then last is the treat, and that's ensuring, and I think this is one area that we definitely continue to try to be able to get the word out to the community in our entire county, is the fact that we do have public health hotel rooms available completely free for our community. We currently have over 1,000 public health rooms available. Folks that stay in these public health rooms oftentimes are not able to self-isolate or quarantine at home. Their average stay is around 7 days in the public health rooms. And while they're there, they have food is provided, laundry is provided. It really is about ensuring that they're safe in these public health rooms. Next slide. And so I talked a little bit about the testing efforts. This is from the week of the 7th to the 14th. But I think one of the things here to highlight, on average, this is around 29, 30 county test sites across the entire county. We're doing some really great work with the county fire, just with touching into those rural areas. And so those are drive up, no appointments. We have 5 drive ups, 6 mobile drive ups. An example of a mobile drive up would be over at the Euclid Health Center in central San Diego and southeastern San Diego. Dr. Rodney Hood's site, we have a mobile unit that goes up there on Saturdays. And so that's a mobile drive up unit. We have walk-ins, and then we have the no appointment walk-in. So these are kind of our newest based on information and feedback we received from the community. So when we first started out, you had to go on the website, you had to fill out, answer some questions to get a testing appointment. And then also we were leveraging a partnership with 211 where you could call and get an appointment. Tubman Chavez Community Center, which is on the corner of Market and Euclid, was a state site. And we started to see that the utilization rate was decreasing, and while the appointments were filling up, people were not necessarily making it to their appointments. Now, at that time, a couple of things. One is our appointments were getting way out there. We had less testing supply, less availability, and the appointments were delayed. So sometimes when those appointments get delayed, then people just, don't go and get the test. So based on the feedback we received from the COVID task force and community leaders, we went with tried out having our first no appointment walk-in site. And it was absolutely amazing to see. So what happened, it converted from a state site to a county run site. So the nurses and the staff at that site are county versus state. And we went to no appointment. When we first opened, we had lines going around and around when we would open, and it was up to a 3-hour wait to get in to get your test done. And as we worked through the process and really streamlined the process, we started using a QR code where people in line could scan this on their phone and then register themselves. So when they got to the front, they would be registered. And that was why it was taking so long. Because when you do it online, you fill out all your information, you get there, you have an appointment, you're good to go. But if we have to register you manually and we have long lines, that was causing a delay. So we now are seeing anywhere to 400 to 500 people a day. The wait is minimal, and it's moving along really quickly. But what we were finding was that people from North County and South County were going to the site because it was no appointment and they were quick. So we opened Cal State San Marcos up in North County on Monday. And the first day we had 250 people, minimal wait. And just yesterday, we launched the San Ysidro Ped East location. And if you want to go to the next one, Stacy, this one, Marlon, I know, is going to talk a little bit about specifically what's happening in Chula Vista. And I just have to give a shout out to Marlon. We've been working really closely. He's amazing to work with, and the city of Chula Vista. These are very specific testing in Chula Vista, but on our website, we have all the locations in South County. We've definitely increased in National City, Chula Vista. We have the one in Imperial Beach at Mar Vista. But the Aquatica is a state site, and the Chula Vista Old Sears building is a state site as well. And everything is on our website. But I just want to quickly mention that, and we'll go on to the next one. And these numbers are a little outdated. So currently, instead of this total being 4,195, 4,195 cases as of today, it's 4,231 positive COVID-19 cases based on those zip codes that I have there. One thing I'll mention, because I know I'm going through this relatively quickly, is if you visit our website, www.coronavirus-sd.com, we have all of this data, enormous amount of data, and we have enormous amount of information. There's some dashboards where you can go in and kind of maneuver the different data points and see the impacts there. But all of this data is posted. And then we have media updates, pressers, usually on Monday and Wednesday. This week it was Tuesday and Thursday because of budget hearings. But everything that's reviewed at the press events are also posted on our website. Next slide. I think here, something that's different, significantly different, and something we're very excited about from when I sent this over to Stacy and today's report out, is that our case rate is actually decreased to 98.3 as of today. So we're below the 100. This is day 2 of being below that trigger. So once after day 3, then we'll be off that. We sort of get off the monitoring in one sense, that we have to continue for 14 days. So we hit the 3 days and then we have to continue for 14 days. What that's going to drive is the ability to reopen schools. And it's 14 days, and then it's an additional 14 days without falling below the 100. So that it's a total really of 28 days. So that we would be able to then reopen. And this is the schools being able to determine that they can reopen at their discretion, the K through 12, and that would be on August 28th, potentially, if this trend continues. So there's a lot of disclaimers in there, but all of this is on our website and we update it every day. But the great news there is that it's day 2 of having that case rate below 100. The one thing that we still are in the red that's we have a lot of concern about is the community outbreak. So as of today, we had, oh, I thought I wrote it down, 22 in the last 7 days. And so the community outbreaks, we also post all of that information and we review it at the press fronts, but it varies. But the highest trending sectors under community outbreaks are restaurants, restaurant bars, and businesses. So again, just really reminding our community, each of us, to make sure we're wearing those face coverings, that we're maintaining that social distance. If we feel sick, stay home. All of that we've all been talking about and sharing is extremely critical. And when we really saw the difference when we started to reopen, and some of that was maybe eased by some of our community. I have to say, as a whole, I think our businesses are doing amazing and they're really adhering to this. But this is one of those things where we all have a responsibility, and it's really important that we just not lower our guard and that we continue with those safe practices. Stacy, am I doing okay on time? Okay, good. So the next slide is the tracing efforts. And this is just what I spoke to a little bit before. And this is really an opportunity. This is one of the ways that we can stop the virus from continuing to spread. And I know many of you have probably heard, sometimes people don't have any symptoms. We have a population of younger folks that are getting the disease and are positive, but they're not feeling necessarily the impacts because they have mild to moderate symptoms. But the concern is then if they're going home and they're seeing grandma or grandpa or someone with chronic health diseases, that is then it continues to spread COVID. So we want to make sure that we, a couple of things, that we can get to people. We've been trying to spread the message in all the different languages and using promotores and using our community members to help our community, that if they receive a call from the county, everything is confidential. We'll never ask for your social security number. We will not ask for immigration status of you or anyone in your household. If you were at an event or a reunion and you shouldn't have been, it's okay. Just tell us the truth, because we want to make sure to stop that COVID from continuing. It's really all about getting you the information, the education. How do you self-isolate? What are the resources that are available? So that really we can connect with all of these close contacts and stop COVID-19 from continuing. And we'll go on to the next one. Binational, I just want to touch briefly on this. We do get a lot of questions because we are a border county. We have been working for many years with our partners in Mexico, in particular our health jurisdictions, not only in Baja California, but along the whole US-Mexico border. One of our sectors that I mentioned related specifically to COVID-19 is our binational. We have biweekly calls with our partners. That includes the binational health plans, the public health jurisdictions, the commission, US-Mexico Commission, our consulates both in San Diego and in Tijuana. So it's a very diverse group, very active. And this group is primarily, these calls are to share information, epidemiological information, any trends, any concerns, any inquiries that there are. Just really about sharing that information and continuing the collaborative partnership that we've had for many, many years. We try to link people to any of our departments that if our partners in Mexico have any inquiries or requests, any specific ones. So it really is about helping to support binationally and bidirectionally. So I think that's something really important. Oftentimes people will ask, is it coming or going? It's bidirectional. We're a very fluid border. We have people crossing the border every day. And even though there are restrictions right now around and limited to essential services and those that are providing essential services or coming across for essential reasons, we do still have a large number of people coming and going every day, which leads to the new PED East testing site. So we launched that yesterday. And it is on the PED East is the side where is McDonald's and the trolley. PED West is the one over by the Las Americas. That is currently closed. So for pedestrians only, not cars, when people come out of the building, out of being cleared by CBP, we have 3 tents on the right-hand side on the walkway. It is county run, so it's county nurses, county funded. It's a no appointment site. There's a QR code that people can scan or will register you. If the person doesn't have an address in the US or prefer not to give an address, all we need is a phone number, an email, and then to make sure that we can ID them, that we have the appropriate name and date of birth. And the reason we want the phone number is to contact them if they are positive so that we can get them isolated and get them connected to the right resources. We started yesterday with, as a pilot, 6:30 to 10:30, Monday through Friday. We had 78 people yesterday, which I thought was really great because there was so much media and so many law enforcement and other partners there that I was a little nervous people wouldn't get tested. But today it was 118. And in fact, starting Monday, we're increasing the hours and going from 6:30 to 10 to 6:30 to noon. All of our COVID testing is completely free. And again, we don't ask for immigration status, social security numbers, resident requirements. None of that is requested. And this is, again, people have asked us why put it there. A couple of main reasons. One is we know that there is a population, it's about 20,000 on the pedestrian side that are coming across for essential reasons. And oftentimes are coming across really early or just really don't have the time. They probably will be taking public transportation since they're walking across. The trolley is there. This is open for anyone that wants to go there. So it's not just the pedestrian crossers. If you work there, if you live close by, if you want to just take the trolley there, you're more than welcome to do that. And then again, it connects back to the efforts that we have as it relates to really impacting those numbers that we've seen in the South County. So I think that that was it. And I'm not sure if there's any questions or what the process here, Stacy, for that, or if it's all through the comments.
I don't see our chair on right now. So if there's any questions, there she is. So if you want to go ahead and see if there's questions, I think you do have a couple of questions, Chair. And Maura's doing exactly what you need to do. Just go ahead and raise your hand if you have a question.
Sorry, I've been on tons of these calls now. I was just, lots of great information. Thank you very much. I was wondering you mentioned that there are public health hotels. Mm-hmm. Are those throughout, I don't know, you probably said this, but I didn't hear it. Are they throughout the county? Are there some in Chula Vista? Where are they spread out? Where are they located? Just out of curiosity.
Yeah, so we actually don't provide the addresses of the public hotels. Okay. And the reason is we want to ensure the confidentiality of our guests. You know, so one thing I do need to mention about the public health hotels as well is it does require a provider. It could be the nurse or the doctor that actually calls and indicates. So you do have to go through your medical provider. For people who do not have a medical provider, please call 211. We will get you linked to a medical provider, whether it's one of our family federally qualified health centers or someone, but we do need that connection via the physician or the medical provider. The reason there, because I often get asked question is why, we want to make sure the person is healthy enough to be able to be in the hotel. So there's those kind of dynamics, but yeah, we don't give the address because of that, but we will work with the person to ensure that it's convenient and safe. The other question is, curious. Yeah, people ask if they can also, is it only themselves, or if there's multiple people that are sick in their household, can it be like a mom and a child and then the rest of the family here? Yes, it can be more than just the one person if that's the safe way to do it.
Okay. I had one other question too, if I could. So earlier you mentioned that if you are exposed to someone with COVID for 15 minutes and you're within the 6 feet, even if you have a mask on, it doesn't protect you, correct?
So we've said with or without the mask. And so the important thing is make sure to maintain your social distance, even when you're wearing your face covering. I think it's really hard to say you won't get it if you are wearing your face covering. And so we have been indicating with or without your face covering 15 minutes and you're closer than the 6 feet.
Okay.
Yeah.
It's very interesting to me because I was just visiting my family in North Dakota before they became a hotter state to watch.
Yeah.
And it was amazing to me that not many people were wearing masks. And there is a big, a lot of opinions about why do I need to wear one, that sort of thing. We wear ours, but
Yeah.
it was very fascinating to me, and I felt great to get back to California.
Yeah. Yes, thank you. Mm-hmm.
Elizabeth, go ahead.
Hi, thank you for the presentation. You mentioned the case rate is below 100 for the county now, right?
Yes.
But for Chula Vista, it's still much higher than that, right?
Yes.
I remember from one of the previous slides, how high was it? Over 1,000?
Yes, it was. Yeah, I think when I
Okay.
figured it out, it was 1,545.6 based on the original number. So yes.
Right. So I mean, every zip code in Chula Vista was over 1,000.
Yes,
Which
you
I
are
found
correct.
pretty shocking. So when you talk about schools reopening to be under 100, that's not happening in Chula Vista.
Yeah, and again, that's what I mentioned was at the discretion of the school district, but yes, there is, that
So
would be
maybe
something that would be
Julian or,
considered. Yeah.
Right. Other
And
districts can probably
yes.
open, but that's not happening probably anytime soon for us. Yeah.
Yeah, and currently we have 48 applications, if I'm not mistaken, pending under the waiver. So currently 48 schools have submitted applications to be considered for the waiver at this point. The kind of for the elementary school, but all of those kind of rates would be evaluated for each of them, and then it gets submitted to the state, and then it comes back if approved.
Thank you.
Mm-hmm.
And were all the commissioners familiar with the waiver process that the state has set up? Barbara, could you just describe that a little bit for us about what that waiver process is?
Yeah, so the waiver, we've actually posted it on our website, that website I mentioned. It's very detailed plan. It does require, and this isn't my area of expertise, so I'll just mention in general, it does require sort of signed offs of the plans from labor, or union employees and parents. So it's a very condensed plan, a very comprehensive plan. Also looks at the rates. And then what are those sanitation and prevention efforts? How is that going to be managed at each of these schools? And all of that is submitted in a plan under the waiver. It goes through this website. We are going to start posting the ones that are approved and the status of the ones we've received. So in terms of full transparency, so that everyone knows. And then it goes to, once it's actually signed here, reviewed by Dr. Wilma Wooten, our public health officer, it goes up to the state, and then it would come back. And that's a very, very, very high level, but we have a wealth of information. We also have a sector school call that's weekly for anyone that's interested in sitting in and listening on the discussions related to that. We have all the sector calls.
One follow-up question and then no more from me. But so with regards to the schools, do you see more private schools applying for waivers versus the public schools? Because I've heard some discussions recently from some people who have kids in private schools, which tend to have smaller classroom sizes and the greater ability to separate the kids at the proper social distancing and that sort of thing. So do you see any heavier application from private schools, or is it kind of all the same?
No, it's not the same. I would say that all the schools are so different, whether they're charter, public, or private. But we will start posting. We just received the first batch. And so we're going to start posting those. The reason we're posting them is also just to ensure that folks know which school districts have applied, and then also just to ensure that follow-up of when they're approved or not approved, because there's some very tight timelines for us as well as the state. So we are going to start posting those in the next day or two. Anything else?
I'm sorry, I was on mute. Commissioner Hernandez Nader has a question.
Hi, Barbara.
Hi.
Question. Hypothetically speaking, say one or a few of the schools in South Bay or Chula Vista are granted a waiver and are allowed to open. Will this waiver also allow for some parents to not, will it provide discretion to parents in terms of sending their own kids to school?
So that would be really hard to answer, but as far as what I've heard from schools in general, it sounds like many of them are planning to be able to have some sort of a hybrid or be able to address concerns of the parents. And so until we actually get those and start reviewing them, I would just say, based on the conversations that I've been able to hear and the presentations that have been done, it sounds like the schools want to be able to meet parents where they're at. So it would be hard to say hypothetically, but that seemed to be the general, what I'm hearing is folks are understanding that not everyone is comfortable with one or the other.
Thank you.
Mm-hmm.
If any other commissioner wish to speak, just go ahead and take yourself off of mute right now. Seeing none, I think that may be it as far as the commissioner questions.
On the item before deliberation. And as a reminder, please refresh, for the commissioners, refresh the view on your screen to ensure new comments do appear.
Will staff please display the public comment and start the timer? Thank you.
All right, so the commenting period for this item is now closed. I don't believe we had any comments come through.
No comments were received. Thank you.
All right, so do any commissioners have any final comments or questions on this action item, or this item, sorry. Okay, so the next item on the agenda is item number 7, COVID-19 city response. Staff, can you please start the presentation and introduce our speaker?
Our speaker today is Marlon King from our emergency operations with our fire department. And I am going to get his presentation up here in just a minute. Sorry. One second. I apologize. Here we go. Marlon, are you able to see the presentation and unmute yourself?
Yes, can everyone hear me?
Yes,
Yes.
we're able to hear you.
Okay, perfect. Thank you. Good afternoon, everybody. As Stacy mentioned, my name is Marlon King. I am the Emergency Services Coordinator for the City of Chula Vista, and in my position, I am responsible for coordinating the city's response to any large-scale emergency that's disaster-related, and any type of pandemic falls into that category. So I'll be providing you guys an update today on where we've been as a city, the things that we've done, and what we're looking to do currently and in the very near future as it relates to COVID-19. As you see there on the screen, it's been 153 days since we've activated our EOC, and we've really been in the thick of it. And I have to also give kudos to Barbara and her team, and as well as the county for their dedication and leadership throughout this pandemic and in coordinating with the cities. We have a great partnership, a great working relationship, and the many resources that they provide to the city of Chula Vista are very beneficial, not only for us as city employees, but to the members and residents of the Chula Vista public. So to Barbara, thank you very much. And also, before I get started, I want to kind of circle back to some of the questions that were asked of Barbara regarding the schools and the waiver. I have counterparts at the school districts who are also emergency managers. So in speaking with them, it is my understanding that they have not submitted, specifically the Chula Vista Elementary School District has not submitted a waiver just yet. Probably also knowing the fact that the case rates here in the South Bay, specifically Chula Vista, are a lot higher than they are in other areas of the county. And the waiver itself doesn't necessarily permit parents to opt out, but the schools themselves give parents the opportunity to choose which model they want their kids to, the instruction that they want to be delivered to their children. So whether it's in person, remotely, or a combination of both, in those school plans, they have several different models of how they're going to deliver that instruction. And before the schools can submit a waiver to the county, in that process, the schools actually have to reach out to their communities, being their parents, to kind of give them an idea of how they are going to do that instruction. So all of that, making sure everybody is in the know as far as what the school plans to do, all of that is required when that waiver goes up to the state for consideration. So there's a lot more to be coming out on that. But at this time, none of the South Bay locations, and to my knowledge, have submitted that waiver, and I don't think they plan to do so for at least one, if not a couple of months. So jumping to the EOC overview, we activated our EOC on March 13th, and And really what that is, it's bringing together city staff and pulling them from their normally assigned duties to focus on the disaster or emergency at hand, in this case, the COVID-19 pandemic. And that requires a lot of coordination of staff, pulling together resources, and basically focusing on what it is going to take to get us out of this emergency, knowing that this is a public health emergency and it's not going to be an immediate fix. Staff are focused on the long haul planning, or kind of where we need to go in order to keep everyone safe, taking into account all of the information that we get from the county public health officer, from the state, from the CDC, from the federal government, taking into account all of the information and protective measures that we can from them, and implementing them as best we can within our jurisdiction. So early on, when we activated our EOC, again, it was focused on internal and external safety and support for the community, keeping our employees safe while they're here at work, and also keeping our public safe out in our community. One big thing about this is the situation continued to evolve so frequently. Really by the minute, information was changing. There was a lot of misinformation going on, and really not understanding the depth of this virus, how it was transmitted, and the ways to keep yourself safe. We wanted to make sure that we provided the public with the most timely and accurate information. Knowing that, again, things changed by the minute, we wanted to make sure we were up to date on everything, and making sure the residents in our community understood exactly the challenges that we faced with COVID-19. And then our EOC was focused on coordination with the county and other partners to provide whatever services were necessary, knowing that we were under a stay-at-home order, and there were going to be restrictions on when you could go out, where you could go, what things were going to be open, what was going to be closed. We wanted to make sure that we were, as a city, helping to fill any gaps that there were in the community, whether it was through feeding services, or people needed information, making sure we were answering the calls, making sure we're making our services accessible to everyone. Again, filling in those gaps where COVID-19 reared its ugly head. Next slide. So here's a little bit of the city timeline, where we were since March 13th, kind of going through now, and apologize for the small font, was trying to get too many things on one slide. But I'll kind of take you guys through the history. Again, we activated our EOC on March 13th with our emergency proclamation, knowing that the pandemic was going to really exhaust a lot of city resources, city staff time, city funding. We issued that emergency proclamation to the governor of California, letting him know that the situation here in Chula Vista was a tough situation, and we realized that it was only going to get worse. So knowing that we were going to be calling on the state and federal government to assist with the resources that they have. We were one of the first cities in San Diego County to issue our emergency proclamation and activate our EOC in response to COVID-19. March 18th was our initial closure of city facilities. I think Chula Vista was probably, if you want to call it, ground zero here in San Diego County, when we had a scare at a AT&T store here in Chula Vista. We were one of the first ones to experience a case of COVID-19, and at that time it was reported that the risk of community spread is very low. So there was a lot of confusion as to what it actually meant to have someone who was tested positive for COVID-19 here in the city of Chula Vista. They were not a city of Chula Vista resident, not even a county of San Diego resident. It was someone from Orange County who came down to a Chula Vista store. But in that, we realized that this was going to be a tough situation to get a hold of, get our arms around. So we, at that time, began our planning and saying, you know what, this is something that we have to get ahead of. So we initially closed our city facilities, and shortly thereafter, on March 19th, the governor issued the stay-at-home order that went into effect basically Friday, March 20th. And at that time, it was a citywide closure of all our services and facilities, except for our most critical public safety services, being fire, police, public works, and animal care. Knowing that these employees fell under the essential workers they fell under the essential workers exemption, these services needed to continue to at least keep public safety within our communities. On March 23rd, our city council unanimously passed the eviction moratorium. It has since been extended several times here in the city of Chula Vista. And we in the city of Chula Vista were early adopters of many of the protective measures, or we were pioneers with many of the protective measures, simply because we kind of saw the situation for what it could grow to be. So we wanted to take action early on a lot of these things. We also engaged in a partnership with 211. 211 is the county basically referral service, call hotline for individuals calling for a variety of needs. They stressed to us that they were experiencing an increased volume of calls. So we as a city have a agreement with 211 to offer our staff as call takers. So we supplemented their staff or added to their staff with our city employees who basically were pulled from their regular duties because we closed a lot of other city facilities. And we could offer this service to 211 for our staff to take calls, and specifically take calls for South Bay residents, Chula Vista residents as well. Our staff, kind of knowing the ins and outs of Chula Vista and the communities that surround us, would offer better services to these folks that are calling in to 211. On April 11th, the city made it mandatory or required face coverings within the city of Chula Vista. And I think we were the first city in the county to make this a mandatory requirement through our executive order by our city manager, who serves as the director of emergency services in any given emergency, any proclaimed emergency. She has the liberty to do so. So through executive order, we made face coverings mandatory in Chula Vista in April, well before face coverings became mandatory anywhere else. We also in mid-April, established a reporting hotline for folks that saw violations of the public health orders or the Chula Vista executive orders or emergency orders, so that we could go out and address these on a case-by-case basis, so that we can really try to seek compliance here within the city of Chula Vista. Also in April, again, knowing that we had staff that were available to offer services and there were gaps in the community, we established a city food delivery service, meaning our city staff, our hotline for folks to actually call in, and we as city employees could go out and deliver meals to those who were maybe food insecure or didn't have anywhere or any mobile transportation to get to any of the food pantries that were available throughout the city. So this was an initiative, and I'm not sure if it was around anywhere else in the county. I hadn't heard that it was, but for our staff to undertake this project was a great benefit to the members of our community. In late April, knowing that the communities within Chula Vista were severely impacted with COVID-19, knowing that South Bay was most impacted across the county, we established a COVID task force, really a Western Chula Vista COVID task force, because 91910 and 91911 were our hardest hit communities. And for whatever reason, we felt like that population wasn't being reached. They weren't getting the message, or they just didn't have the resources. These are essential workers. They don't have the ability to stay at home. They don't have the masks. Whatever the case may be, we recognize this as a potential issue, and we wanted to address it. So establishing this task force was through our police, fire, our code enforcement, and one other department, I can't remember, probably public works. These were groups of bilingual speakers going out to the businesses and residents in 91910 and 91911, basically walking up to anyone and everyone and any business and educating them on the effects of COVID-19, educating them on the protective measures, educating the businesses on what their requirements were for ensuring customers wore masks when they came in. And not only educating these folks, but then offering them resources, offering the businesses masks that may not have had a cash to give to their customers. So again, this task force was established, and for an entire week, walked up and down the streets of Western Chula Vista, basically educating the public on COVID-19, specifically within that community, letting them know, hey, this area is basically what they call a hotbed for COVID-19, and we want to make sure that everybody in the community is aware of it and that it's real. And these protective measures, these non-pharmaceutical measures, are the only way that we have to fight against it. As we started to come out of April, and as everybody in the county really was getting annoyed with the stay-at-home order, we followed suit in reopening parks for a limited activity. We as a city were probably one of the last jurisdictions to start opening parks or restoring services, simply because we were the hardest hit. Knowing that we had no control over where the virus was going, we didn't feel comfortable reopening as fast as everyone. So there was a limited reopening of our parks for really passive activities, activities that involve limited contact or no contact with other individuals, so that we didn't contribute to the spread of COVID-19. And then, as we all know, the reopenings countywide or statewide, really nationwide, led to this, what some folks call as the second wave, but is likely still the first wave. So I think our posture in kind of reopening very slowly and not even opening a lot of services was a good move on the city's part. So in early May, we coordinated with the county to bring a testing site to Chula Vista. Again, everyone saw the need for testing in South Bay. There's still a need for testing in South Bay, which is why there are so much focus, which is why there's so much focus down here to bring more and more testing, and the city's engaged in that effort as well. So we partnered with the county to identify a location, which is the former Sears building here in Chula Vista, to open a testing facility, a walk-in site. This is a great facility. It was doing right around 280 tests a day. That included walk-ins. They were including walk-ins in that, so it wasn't just appointment only. So I think the testing in Chula Vista, the site in Chula Vista, was a great benefit to our community, because so many people frequented that location to get testing. 7 a.m. to 7 p.m., 5 days a week, is very beneficial, a very beneficial service to our community. And that location is still going, and the numbers are still very good at that location. As Barbara mentioned, we have another location at the Aquatica site. That one came online a bit afterwards, probably sometime in June, for another testing location in Chula Vista. We also engaged in the public awareness campaign in May, and we have another one going currently. But the public awareness campaign, again, was targeted to our Western Chula Vista communities, Spanish campaign, that brought information, brought resources to the community, ensuring that they were receiving the message. So for those folks who are non-English speaking, we wanted to make sure that they were getting the same message being received that was being broadcast on traditional media and other outlets. Excuse me. Some additional actions that we've taken. Actually, Stacey, you can go on to the next slide. Oh, go back one. So this is a couple of photos. So as you see in the top right, that's a photo of our briefing for our COVID task force. So we had a briefing with our police, fire, our public works personnel, and our code enforcement. Every day that they went out that week, we had a briefing. We had a area that we were looking to target, and we gave them information and the resources to distribute within those communities that they went out to. On the bottom left, you can see a hand washing station. This is through a partnership with the county, knowing that one of the legs of the protective measures, or the legs of response to COVID-19, was proper hygiene and sanitation. For our homeless populations, or just anybody walking and need a quick hand cleanse, we installed these hand washing stations at locations throughout the city that would be highly used. Knowing areas where homeless congregate, or areas that are frequent foot traffic, we installed these hand washing stations so that they can be of use to members in the community. Next slide. So planning, as I mentioned, our EOC was activated back in March. At that time, we were probably meeting, I would say, every day. We had a planning meeting every day to figure out okay, what's the latest with COVID? Because things were changing so rapidly, we had to meet every day to determine what's the latest information and what action should we be taking. As it stands now, our policy group, which is our executive level team here at the city, we meet twice weekly to discuss the direction of our response. And what that includes is any updates to the local public health orders, looking at the localized Chula Vista data. We have partnerships with Scripps and Sharp Hospital to see how many people they're testing and what the percentage of positive is at those hospitals. Typically, they're able to get the information down to a science where it shows that it's specifically South Bay residents. We would like just Chula Vista residents, but knowing that we have a lot of folks traversing our city that are from the South Bay, we know that the South Bay data still gives us a good idea of how prevalent the virus still is here in our community. And then once we do have that data, what are the next steps? Is it safe for schools to reopen? Do we need to have a conversation with the school districts and say, hey, we don't think this is a good idea? Or should we be reopening our libraries or recreation centers, things like that? So looking at the information that's available at hand and making educated decisions on how best to restore services, restore normal life, but still keep individuals safe. Next slide. So response actions that continue to occur, we continue to provide personal protective equipment to all city employees and the public on our fire apparatus, on our in our police cars, on our park ranger vehicles. We have a cache of masks as they go out and engage with folks in the public. And if there's someone that needs a mask, they're handing out masks. Sometimes they'll hand out bottles of hand sanitizer, whatever resources may be necessary. Most oftentimes it's masks, and when they see someone in the community or in the local park and they don't have a mask on, they're encouraged to give masks out freely. Increased cleaning at our public facilities. So we have upped the cleaning in our city parks. Parks are reopened. The facilities at those parks are open. So we understand that we need to increase the cleaning. Again, this is one of those protective measures that we have to implement. Non-pharmaceutical measure. This hygiene and sanitation is an important part of our toolkit to fight COVID. The public messaging and media campaign, again, that's still ongoing, working with local community groups to get this information out, working with the airways or any other types of media that we can get this information out to members in the public. And then partnering with local community groups to continue to deliver these services through South Bay Community Services. I believe we have a rental assistance. We had a rental assistance program occurring, working with the county to bring additional testing sites here to Chula Vista, engage in the tracing aspect of the fight against COVID. We continue to support the large-scale food distribution events. Our police officers are there helping with the traffic flow. We as a city actually helped host one at Southwestern College, one of the largest food distribution events. Agreements with T-Mobile and other telecommunications providers to purchase Wi-Fi hotspots for families in Chula Vista who need connectivity for their children. We continue to have our compliance team here at the city go out and investigate the reports of violations, whether at local businesses or whether at a city facility like a park, or whether at someone's house. There's random house parties, or these house parties keep happening. We have our compliance team go out and investigate these violations. Also, we've established through the funding that we received from the state and county, we've established a small business grant program to help some of the local businesses. Obviously, businesses are severely impacted due to COVID-19, and we as a city want to do what we can to help these folks out. So we continue to offer or look at creative ways to offer a variety of support, knowing that there's no vaccine and it could likely be months, probably into 2021 before we see some type of relief. We chose to adapt and see how we can continue to support our community. Next slide. So our current initiatives, as I mentioned, increasing testing capacity, and City Manager Maria Cachadorian alluded to it earlier when she made her remarks, but we as a city are looking to use our EMT staff to actually deliver testing. We as a city know that we need to have more of a stake in the game. This is our community, and we want to help our residents. We are offering our staff to open up another site here in Chula Vista. So the plans are in the works, working with the county to do that, and hopefully by sometime in early September, we can have another site here in Chula Vista, and that goes along with the tracing as well. And then continue to maintain safety of our employees in the community. Again, looking at ways that we can fight the virus with non-pharmaceutical measures, looking at creative ways where we can spend our monies to keep everyone safe. Working with the local businesses and operation to keep them delivering their services. Everyone has to work outdoors now. Indoor restrictions are in effect, so those businesses that can work outdoors, we want to help them. We want to help them do that. We're offering our spaces in city parking lots, out in open space in the park, to allow gyms and yoga studios, making it easy for any business that wants to operate outdoors. We want to make it easy on them to actually do that. And then continue to evaluate how we can restore additional city services. In keeping with the times, again, offering many online services through whether it's development services, plan delivery, plan review, submissions, whatever it is. We want to make sure that we continue to make things easy and accessible for members of our public and restore additional services as they are basically approved and safe to do so. And next slide, I think that'll be it for me. So I am available to answer any questions, and thank you for your time.
Does anyone have any comments or questions?
You can go ahead and raise your hand or just take yourself off on mute. I see Commissioner Hernandez-Nader has a question. Go ahead.
Thank you. So embarrassing. I couldn't find the mute thing. And anyway, thanks for unmuting me. Hi, Mr. King. I appreciate the presentation. Very thorough and really informative. I may have missed the last part when you mentioned something about exploring possibilities for opening a site soon. I just wanted clarification on what the site was, and I wanted to provide some input if possible on your
Yes.
part to find the site.
Certainly, we are looking at establishing a site at our Orange Library, which is in the 9191 zip code, 91911 zip code. So we're looking to operate that site most likely 5 days a week. We're trying to fill a gap. Basically, we want to offer it non-appointment. As I think Barbara mentioned, that folks that have to make an appointment and the appointment is whether it's 6-7 days out and they say, oh, I'll just forget about it. We want to make it easy on them to say, take a look, and oh, the line's not too long, I'll go jump in. Also knowing that really no sites down here offer the services on Sundays. I think our Aquatica is closed on Sunday and the Sears site is closed on Sunday. So we want to include that as one of the days in our testing. And then after hours, again, knowing that a lot of our community is essential workers. If they're going to work, they're not able to get to the site in the middle of the day. A lot of sites close roughly maybe 4 or 5 p.m. We want to extend a little bit into the evening to allow those folks maybe to come after work as well. So trying to make it more accessible and more convenient for the members of our community.
Thank you. So that's a testing site, a COVID testing site at the Orange Library.
That is correct.
Okay. I'll take this time to share a story. It'll be really, really quick. I'm the District 4 representative for the commission. And in an effort to stay healthy myself, I had a personal trainer meet me at the park that is here in the Castle Park neighborhood. It's very large, a lot of open space. So, we socially distanced and we kept our masks on. During our last session, I noticed that the park had a bunch of spoons just trashed everywhere. Spoons that I'm sure you can imagine their previous use.
Mm-hmm.
And I I mean, I have to commend the efforts of the city of Chula Vista, the employees, and I know that recently you all had to downgrade in terms of staff, but what efforts are in place to serve the community, the Castle Park community of Chula Vista, to avoid that type of like disadvantage. I know this is probably not popular to say, but I had to clean a lot of that trash up myself with gloves, because I couldn't imagine leaving it there for a child to pick up, if they came over and played basketball or just played on the grass.
Right.
So,
Right.
yeah.
So I know that our park rangers in addition to reassigned recreation staff, are doing a lot of cleaning in our parks. When the parks were initially closed, I think it was a setback on our staff to go out and actually do the cleaning. I think they have a good plan in place now to actually go out there with additional staff and make their rounds, whether it's 2 or 3 times a day. I'm sure that it's still hard for them to keep up. I imagine there's a lot going on out there. I will certainly bring that back to our community services division to ensure that they're aware of the concerns. But I've seen firsthand how busy our folks are out there actually doing the cleaning. So they probably just need a little bit more help, and hopefully we can get that for them.
Can you mute me? Because I can't. Yeah, thanks.
Commissioner Murphy?
I commend you and the city for your proactive response. And I just had a quick question about the food delivery. Is that still continuing? And if so, for how long is the plan to continue the delivery?
That I'm not sure, Aaron, you might be able to help me on that. I think the program is winding down. It wasn't being as heavily utilized anymore since things started to reopen. But Aaron, if you could correct me if I'm wrong.
You know what, we had thought about it, and then when our library staff started helping the 211 hotline, we started getting a lot of calls, and the majority are seniors that are homebound. But as of today, we're continuing to do that Monday through Friday, and we usually deliver between the hours of 8 a.m. and about 1 o'clock in the afternoon. If you need the hotline number, I have it handy.
How many deliveries do you make every day?
Today, I was assigned to do deliveries. I did about 6 today,
Okay,
and they
so
were
it's
scattered all around.
just a handful every day then?
It goes from a handful to about, we've seen as many as 40 in one day.
Okay.
So,
And are you in partnership with someone like the San Diego Food Bank, or who provides the food?
that's exactly where we get the food from. We store it, and then they call either 211 or the hotline number that the city provided, and our recreation staff go out and deliver it personally.
Okay, thank you.
And I just wanted to quickly acknowledge Aaron. So Aaron actually is going to be presenting a little bit later on our last item, but he is the supervisor for the Otay Rec Center and our Norman Park Senior Center, and clearly has been reassigned right now to do other duties as well.
Hi, everyone.
I have a question, and I may have missed it, but I understand that you guys are working really hard, and we appreciate for getting more testing sites. And you mentioned the different hours and opening on Sunday. I know initially, like a few months ago, when testing ramped up, I saw a lot of advertisements. I heard about it a lot, and I even started sharing with family and friends, like, "Oh, go get tested. It's free." The county, the city's trying to get everyone in there, but I haven't heard much about it anymore. Is there still efforts to advertise or promote the testing? Because I think it's great that we have them, but if people aren't hearing about it, they're still not going to go.
So I can speak for the city. We are certainly advocates for people continuing to go in and get tested. I know that we continue to message through our Office of Communications on any platforms that we have available to us that testing is available. I know there has been a bit of a lull in testing, or maybe a slow in testing, and I simply think it's because there are a lot of testing sites available. Testing is not exclusive, so to speak, anymore. People can really get a test almost anywhere. I think there probably is a testing location in almost every jurisdiction. Specifically speaking, in the South Bay, again, there are several testing locations, the two in Chula Vista and in southern San Diego down in Imperial Beach or down at the border or in San Isidro. There are testing locations available for folks. As far as the advertising goes, we, the city, continue to advertise for that, and I believe the county does as well. It kind of, we might just be numb to it, I think, in my opinion.
Yes, Stacy, did you want me? This is Barbara from the county. So we have a very robust social media, paid advertising, Spanish and English, doing a lot with whether it's Radio Latina, La Invasora, La Poderosa, using some of our DJs also on the English radio, TV. Billboards, we just put a big billboard in the south at the border, but looking at the different billboards as well. So definitely trying to get the information out there about all our testing sites and leading people also to 211 or our website.
But certainly we value this commission's input, especially as representatives of your different districts and experts in the field. So if there's other ideas that you have, please feel free to, to contact me directly through Healthy Chula Vista, or if you have any input today, we're happy to take that as well.
Thank you.
Did any other commissioners have any questions? There's quite a few people that don't have their video on right now. So if you do want to speak, just go ahead and take yourself off of mute. Seeing none, I think we can move forward.
Okay, so I will now call for a 2-minute pause to allow the public to submit any final comments on this item before the commission deliberates. And commissioners, as a reminder, please refresh the view on your screen to ensure new comments appear.
Will staff please display the public comment and start the timer? Thank you.
I apologize. The timer is not currently moving for me, so I apologize for that. Hold on.
Stacey, as of now, we do not have any public comments.
Okay. Thank you, Patricia. So the commenting period for this item is now closed. Any further comments or questions from the commissioners before we move on? All right. So the next item on the agenda is item number 8, Climate Action Plan Equity Index. Staff, can you please start the presentation and include our speaker? Introduce our speaker, sorry.
Yes, we have Corey Downs from our Conservation Department with us today. And Corey, you should be able to see your presentation now if you want to go ahead and start.
Perfect. Well, thank you very much for inviting me to come speak today. It's really great to hear about all the great efforts and response that the county and the city and the whole community is doing for COVID. And it's, unfortunate, as we all know, these crises don't kind of exclude each other. They're a kind of add on to each other. So today I'll be coming to talk about our effort to create what we're calling the Chula Vista Climate Equity Index, so that we can better take a look at how existing conditions in our community kind of shape how climate change and some other health aspects like COVID can impact various community members. And next slide. So to start with a little bit of background, this as a part of the climate change working group, a number of members have pushed for more focus around equity in our climate action plan and in city planning in general, and trying to ensure that all community members kind of have the equal opportunity for success. But as you can imagine, that can be a little bit of a daunting task. And at the time of the previous climate change working group meetings, we kind of didn't know what the best way to go about that would be. We saw the city of San Diego that put out a very similar report, San Diego's Climate Equity Index, last year, and it's had a really great path forward for us to identify which portions of the Chula Vista have had this disadvantage, have had the disadvantage, and use a very mathematical kind of approach to looking at that, so we know that we're looking at the right factors. So based on that, we contracted the same consultant, the University of San Diego's Environmental Policy Initiative Center, or EPIC, to conduct a similar study, and they're currently working with us to do this study. Next slide. And you might all be familiar with the Cal Enviro screen, but I kind of wanted to provide an opportunity to showcase what we'd like to receive or to achieve out of this project. So the map that you're seeing right now is a Cal Enviro screen score looking at the disadvantaged portions of our community. And as you can tell, it's important and very, it's definitely going to be something that we use in our planning, but it does leave a lot of Chula Vista out. And that's one of our concerns. One of the stories that I say or I tell that kind of drives this point home for myself is we were adding electric vehicle chargers to City Hall and our police department. City Hall was in a disadvantaged community, and so it received a lower, more of an incentive for the electric vehicle chargers. But the police department that was just across the street from City Hall was not. And so, you know, those police cars that are still driving in Chula Vista, they don't stop at that intersection. You know, they drive throughout our community. So we want to make sure that as we're drawing lines through our community, that really reflects Chula Vista, and that we're not, you know, leaving or omitting important opportunities for us to increase opportunity. Next slide. And so for goals for this effort, this is a map that the city of San Diego created. But our goals for the Climate Equity Index are to listen to stakeholders and learn from them to see what are the important characteristics, what are the important data for us to take in and consider for this inventory. Then we want to take that data and create a useful tool to assist city planning efforts for climate action planning and other planning in general. And then hopefully update that over time so we can see how the actions are having impacts in the community. This is a census tract level analysis, so it's not very, you know, it doesn't have a high level of detail, or has some limitations on the level of detail that it has. But we hope to see some changes over you know, time. City of San Diego is looking at updating every 5 years, and we hope that would be a goal, an opportunity for us as well. Next slide. And so how that happens, and the kind of the steps that the consultant is going to go through to create that index, starts with determining the indicators, and I'll go into some of those later. But the indicators are really kind of the raw data, and what types of data are we looking at, and then they can collect that data for the entire community, but evaluate it based on census tracts or other geographic scales if possible. If we have the data at higher levels of detail, we can use that. And based on that, as you can see in the kind of the example in the map here, different census tracts will come up with different scores, and we'll be able to combine the different indicators that our stakeholders select to come up with a climate health and equity index that ranges from high to low for the different census tracts of our community. Next slide. We've held one community stakeholder meeting so far, and we're going to be holding another another meeting next week. On the slide here is a list of the community members that have participated. And there will be, if there's others that you think would like to participate, or if you would like to participate, feel free to let me know. We'd love to add you to the group. And we can also receive input via email. And we know a lot of people have a lot of commitments right now, and if they're not able to make the specific meeting time that we have, we want to provide a way for them to receive information as well. And I'll provide a link to a email or an online survey at the end of this presentation, and you will be able to provide some input as well. But I do think that we have a broad group of stakeholders that are really engaged. The first meeting was really great, and there's a lot of stakeholders that are really passionate about protecting and promoting Chula Vista and disadvantaged communities in Chula Vista. So our next meeting will be focused on the actual indicators that I'll talk about in a little bit. And I think it should be a really good conversation for focusing in on what are the specific elements that are most important in Chula Vista's index. Next slide.
Corey, I just wanted to point out, in case somebody didn't notice, that we do actually have representation from this commission on this current stakeholder list. And that's certainly not to say that you couldn't also add yourself if you were interested. But Roman Partito Lopez, who just not is able to join our commission meeting today, through his work is sitting as a stakeholder.
Yeah, and we're really appreciative of that as well, and appreciative of all other inputs as well. We definitely want to cast a wide net for this effort. So this is a list of the City of San Diego's climate equity indicators lists. We're kind of using this as a first starting place for Chula Vista, but we know that the ending location might be a little bit different. And there's a broad variety or broad categories of indicators, ranging from environmental indicators that are reflective of the environmental location that the individual is at, or the census tract is at, as well as socioeconomic indicators, looking at different mobility indicators. We know there's a lot of really importance around that. And then finally, the housing indicators, and very important for this group, the health indicators as well. And so there's a lot of different opportunities for us to look at. And I know, maybe some different stakeholders think other individual indicators are really high priority. And so to help us kind of weed through some of these, or to see if there's others that are not on this list that are important for Chula Vista, we did create a survey that you can access on the link down below, and provide opportunity to rank each of these indicators, or provide additional indicators if, like I said, there's some that we're not seeing here. I think, as I mentioned at the start of the presentation, we saw with COVID that the crisis doesn't put all the other crises and challenges that residents are facing on hold. And so, it's, I think, it's a really good perspective when we are looking at doing climate policies or other types of city planning, to use some of these indicators to take a kind of a look and a better perspective at the starting location for different parts of our community and different community members there, so that we can better tailor the programs to succeed in those communities and for those residents and businesses. I think this is, I will say, like I said, we have the survey out there, and I think that's kind of the most straightforward way to provide input on any of these indicators. But if there are any that members would like to mention as important, or if there's any that you'd like me to add to our list, feel free to let me know. Next slide. And then finally, I just wanted to end with some next steps. As I mentioned, July and August, we'll be meeting with stakeholders. We had one meeting in July. We'll have one meeting next week. And that's beginning to gather some of that data, define what the indicators that the study and the consultants will be using. And like I said, we hope to come away with at least a draft list at the end of our next meeting, And if there's any interest, we can kind of share that and get feedback on that as well. And then roll that into kind of, now that we know what we'll be looking at and evaluating, our consultant will be finalizing that analysis, working and gathering all the data, crunching the numbers, and creating a draft report for us to share with stakeholders and continue to kind of refine as we need to, with the goal of bringing a report to the Sustainability Commission and City Council in November and December. And that would have the full report with a equity index map, as well as all of the information that went along with the index. We're also interested in not only providing the index, which would be kind of that, the census tract level of all of the indicators combined, but also highlighting some indicators that staff think and the stakeholders think are particularly important for Chula Vista. So, I think a good example might be if one of the indicators is tree cover, we can provide a map of that and show you can see the differences between how that one indicator goes through and gets merged with all the other indicators, or individual indicators too. So that residents who are looking at the map will be able to kind of see the overall index, but also dive into some of the individual indicators and, really focus in on, are there some specific areas that have issues with some of the specific indicators that we're looking at. So we're hopeful that it will be a flexible tool that staff and residents will be able to use going forward. I think that was my last slide, but like I said, I'm happy to have any conversation about potential indicators or answer any other questions that members might have.
Any comments or questions? I have one comment and one question. I guess I can go. So the comment, I guess, would be for potential indicators. I don't know if it's something that's been communicated, because I thought I had heard rumblings that the city was working on this, but power lines, putting them underground, is that something that would be considered equity, because you don't see it on the east and you see it on the west? I don't know if it has to do with climate equity or not, but something that popped into my head.
Yeah, no, I think that's a really great one, and I will raise it to the consultants.
And then my question is, I think it was in the second slide where you had like the map of the Chula Vista area with the section that was red.
Mm-hmm.
The map was blank, basically, because you said there isn't anything on there, but the red area, some of it's part of the port. Is that why? But I see a little section of red down by Anita Street. I'm not sure. Can you explain that a little bit better?
Yeah, absolutely. So this is a map of CalEnviroscreen is a tool. It's a statewide tool that allows anybody to evaluate what the state calls disadvantaged communities. So it's a very similar product to what we're doing right now, where they take indicators and they evaluate everything at a statewide level. But because it's at a statewide level, some of the kind of like the scale bar sometimes doesn't always capture as much diversity in individual jurisdictions as we might think that there is. So if we look at what the tool describes as disadvantaged communities, it is that section of the red that is on the very west side of Chula Vista and a lot of the port area there. And so it's a small sliver of Chula Vista. And so our hope is with the Climate Equity Index that we'll be able to take a more broad perspective, focusing in on Chula Vista. So we're not, so we're able to kind of see, yes, that, I think that there will be a lot of areas in the West that that also score high on our index, but we'll be able to see a little bit more details about other portions of the community. So it's not just so black and white. Like I said, are you on this side of the street or that side of one street? And that's really the only indicator that we're using. The index will hopefully provide, like I said, a little bit more detail and more information on the broader aspects and data of this type of this for our community.
Got it. Thank you.
And I think you can pretty much tell, but essentially it's the I-5 corridor and our trolley stations, which really show up on this particular map.
Okay. Yeah. Thank you.
Were there any other commissioners with questions? I'll stop sharing so that I can see everybody on my screen. Was there anybody else that had any questions or comments for Corey? And Corey, if you could share the link in the chat box for the survey, that would be wonderful, or I can do so.
Sure. Would I send it to the host or presenter?
The panelists.
I don't have that option.
Okay, I'll go ahead and share it then. That's not a problem.
Okay, awesome. Thank you.
No problem. So if anybody else wants to take themselves off on mute if they want to speak. Seeing none, thank you very much, Corey.
Thank you. Okay, so I'll now call for a 2-minute pause to allow the public to submit any final comments on this item. And again, everyone please refresh in case any comments pop in. And I guess we will start the timer.
Please start the timer. Thank you.
Having difficulty with the timer again. Was working earlier. Patricia, if you could just record 2 minutes here, because it seems not to be working right now.
Yes, we'll do. Thank you. We have about another minute. Okay, your 2 minutes is up and no comments have been received. Thank you.
Okay. So the commenting period for this item is now closed. Anybody, any commissioners have any final comments or questions on this item? All right. So the final item on the agenda is item number 9, connecting older adults with technology. Staff, can you please start the presentation and introduce our speaker?
Well, we're not going to mess with technology anymore. So Aaron, even though this is the technology item, right? So I've already introduced Aaron, and he's going to speak to us about some of the initiatives he's been doing in our age-friendly world.
Hello, everybody, and thank you for having me, and nice to meet you all. Aaron Ruiz. So one of my main duties is to oversee the Norman Park Senior Center, and senior services go along with that. And it's quite a busy time for us. As we know, with the pandemic, seniors were hit harder, and you know, the pandemic is a lot deadlier toward them, and they've been doing a good job. The numbers have shown that it's the 20 to 29-year-olds that are struggling now as we are reopening businesses. But one of the things that we continue to manage is looking at ways to help the senior community, as we know that that population is going to quadruple in the next 10 years. So it's important for us to pay very close attention to that. You know, Supervisor Cox calls it the silver tsunami. So in paying attention to that, right now, right now, seniors as it is have battled through senior isolation. And that's something that's terrible. And it comes with, their kids have gone to college or moved on, gotten married, or unfortunately they've lost their spouse. And so we encourage them to come to our facilities and just participate and socialize. As I tell my staff every single day, our goal is to just to get them out the door. And that's so that they can participate in something. Well, right now, as we're asking them to stay at home, that's extremely difficult. It's extremely difficult just to go shopping. And so we saw a lot of stores that did an amazing job giving them having the excluded senior hours for them. Right now, my colleagues mentioned the food hotline. Primarily, it was set for seniors. One of the other tasks that my colleagues and I have is that we are calling seniors just to check in on them. So we do have welfare checks that the police department has, but I think for us, it was just a simple hello. And in the beginning, it was just a lot of food insecurity questions and us providing resources to that. 3 months later, we're just talking on the phone, and some conversations go 30, 40 minutes. Other conversations are quick, but all that means is technology is needed now. We knew technology. We knew that there's a gap between generations with technology and with seniors. This year had High Tech High students come to the senior center and provide classes, and it was just the very basics. And so right now, even just visiting the doctor is difficult, and so we're resorting to telehealth. And what I'll say with that is some seniors are probably not going to do that because they're not comfortable with technology or they just don't know. And so the loss there is that the senior is not going to get the care that they need. Also, we saw doctors, because this is new. In the beginning, doctors weren't getting paid for it. It was because this is new, right? And so now, luckily, we did have a bill that was passed to, have them as part of their program or part of their practice. So we started looking, Stacy and I, we've been trying to dissect this, is we've seen a lot of great organizations go online. So you can take a yoga class, you can see all the how-to videos. The county does an amazing job with that. So does the YMCA on just providing some videos and tutorials. But we needed to go down to the basics. When we looked at it, there's a lot of seniors that don't even have Wi-Fi access. And that was going to be a problem with isolation, with their health, because they're not going to be able to communicate with their doctors. And we're all doing Zoom meetings and Zoom parties. They're not. So imagine the world where we are already desperate and we've resorted to this. Imagine living as a senior right now through a pandemic. It's horrible. I have a tough time with my 2 kids. So that's something that we've looked at. And Barbara and Marlon mentioned the hotspots because, we've had to resort to distance learning. Well, Stacy and I have been looking at possibly getting those to the senior mobile home parks, because those are the communities that we've noticed are probably in higher need. And so we just need to get them connected to the internet. And then we could start with the tutorials and the how-to videos, getting them to feel comfortable with Zoom and all the other different types of apps that they can use. If they can't go to the store, maybe they can resort to, getting their groceries online, and how to do that, how to sign up to Uber. And the way I explain it to my employees is, if you forget your password to something, it's a long process. So imagine a senior who already is, thinking negatively about technology. It's going to be extremely hard. So we're looking at ways to just get the connection in. It seemed like the senior mobile home parks was a great idea to start and kick this off, because we need to get them connected to the internet. We need to let them know whatever we see on Facebook to keep us up to date on the news. Well, they don't have that. And they do have television, but that's a limited source. And they want the local stuff. They want to know that we have a food hotline. They want to know that how they can go maybe somewhere. The Sweetwater Union High School District talked about having Genius Bar locations. We need to have those for seniors, because we need to connect them to their doctors. We need to connect them to their family. And so that's one of the initiatives that we're highly working on. Lastly, I'll just mention, at the Sears building, we also have a cool zone And that's because it was hot today, and it's going to be extremely hot this weekend. Well, part of that Sears building, we have a cool zone, and we've been getting a lot of seniors that come in, and we help them a lot with their technology, just getting signed up for a COVID test, and to us, it's extremely difficult. I can't imagine to somebody who just didn't have technology at their hands growing up. So Stacy, I don't know if you wanted to add anything to the project with the senior mobile home parks.
Yeah, I would just add that there is an organization that has been looking at this as well, and that we're looking at potential funding opportunities. And so we really just wanted to bring it forward today to you to see if there's other gaps within our senior community that you're seeing as experts in the field and in the community, and if there's any additional thoughts about technology with our seniors and things that we should be looking at as we're seeking funding.
I wanted to mention, we do have a grant that's coming out of our SOCAN group, and SOCAN is a group that meets because of the county, and we're looking at getting a huge donation to get devices. So not only getting them connected to the internet, but they need devices. If we can have a room at a mobile home park, maybe maybe one day we can get them all a device and a hotspot in their home, but at least have an area where they can go. And we need to follow it up and do our duty with teaching them, as we have to continue to teach ourselves, because technology changes every year, every day. So we do have donors that are looking at that, but obviously, AT&T, T-Mobile, we're talking to them on just helping us out because it's extremely important right now. So I just wanted to mention that we have gotten some traction with some devices.
Hello, Mary Cruz, Aaron.
Hi.
Is there a session on how to turn your camera on?
She's asking if you can help her turn her camera on, Aaron.
Oh. Whew, that's a hard one for me. Nice to hear from you.
Go ahead.
Okay, sorry, I have like 2% left on my iPad. I apologize. I've been on calls all day, so if I drop, it's because of that. It's perfect timing that you bring this up. I work with I'm a Rotarian in the Chula Vista Rotary Club, and I'm also on their board, and we're just now formulating some ideas of potential people that we can do hands-on projects with, possibly give some monetary donations. We're working on budget with the community projects committee right now, so I would love to hear a little bit more via email. Maybe we can talk offline.
Absolutely.
Okay, that's it. I'm sorry, I'm about to lose you guys, but I just wanted to get that in. If you could email me, do you have my email, or you can get it from Stacy?
We'll be able to get in touch with you. Yes. Thank you, Maureen.
Thank you.
Thank you so much, Maura.
You're welcome.
I'm not seeing anybody else take themselves off of mute, so I think that may be it for the comments on this particular item.
Okay, so I'll now call for a 2-minute pause to allow the public to submit any final comments, questions, and then everyone refresh your screen so that we can make sure that if there are any comments, they do appear.
Stacy, I can monitor the
Thank
2
you.
minutes on my end.
I have kind of given up on that at the moment.
Just play the Jeopardy song. Maybe that'll.
And I will just note while we're in this pause that I did add the survey that was in Corey's presentation link onto the chat in case you want to copy that.
We have about 1 more minute to go. 2 minutes is up and no comments were received.
All right, so any final comments, questions, or directions? Okay, so this concludes our main agenda, and we will now move into staff and commissioner comments. Staff, do you have any additional comments under agenda item number 9?
I do have one item underneath there. I want to be very brief. I appreciate everybody's patience with this new technology. I appreciate Lucia jumping in today as our chair. It was a very last minute jump, so I really appreciate her. And I apologize to our new members that we're not able to be in person and to get to know each other in a more formal way. But hopefully we'll be able to do that over the next couple of meetings, even if we are virtual again like this. So the one item, though, I did want to share with you all, actually, there's 2 things. The one that's on your agenda is the Healthy Cities and Community and Counties Challenge. UCSD, through the Childhood Obesity Initiative, I sit on their government domain. And through them, you may recall, some of you, the CDC REACH grant that we had for several years, a few years ago. I know Lorena was heavily involved with that in her previous employment. We, as an extension now of the Childhood Obesity Initiative, UCSD now runs that grant through the county, and they applied for a grant for a 2-year period through Healthy Cities and Counties. And they received it to expand their Mas Fresco model, which provides fresh fruit and vegetable stipends to CalFresh recipients. And they are expanding it to the Northgate market here in Chula Vista. So over the next 2 years, this grant will provide education to promotoras and a resident leadership academy to educate around healthy food consumption and provide the families that participate with a $100 stipend a month towards fresh fruits and vegetables through the Northgate market. There is a leadership committee consisting of San Ysidro Health and the Chula Vista Elementary School and several other partners here in Chula Vista that are working together. So I think there's going to be even more that comes of this because the grant is just starting. And we already had some fabulous ideas on our first team call yesterday. So we're really looking forward to that. And we'll probably do a bigger presentation for you in the upcoming months. And they also are going to be doing a press conference and release of this information next month. So you're getting a preview of that today. The other item that I did just want to mention to you is something that you're going to see coming up in the next few weeks as well. The city has also been contacted by UCSD to assist with a vaccine trial for COVID-19. UCSD is doing several of them, but there's one in particular where they are just not getting representation for the most impacted communities. And so they've asked if they could come here to Chula Vista to provide a vaccination trial. So you're probably going to be seeing something about that in the next couple of weeks. It's basically a month-long process that they would be participating in. So I just wanted to give you, as the Healthy Chula Vista Commission, I wanted to give you a heads up on that. There's going to be more to come and more coordination with our healthcare providers in Chula Vista around that. But I did just want to give you a heads up. That's something very new that just came about as of yesterday. And that concludes staff's comments. So Lucia, I'm unable to hear you currently.
Sorry.
There we go.
Here I am. I had put myself on mute.
It didn't look like you were, so I was confused.
Oh, I was doing it through my phone, that's why.
Oh, I get you.
Yeah. Okay, so I don't have any comments this evening. So the final item on the agenda is item 11, which is me, and I don't have any comments for today. So any comments from other commissioners that you thought of as Stacy finished up her last 2 items? Nope. All right, so I think I can adjourn now, right, Stacy? All right, so it is now 6:15 p.m. and I am adjourning this meeting to the next meeting. I don't know if we have it, I guess it is scheduled for September 10th, 2020 at 4 p.m. Is it going to be virtual or is that not accurate for?
Yeah, at this point we are all virtual and until otherwise told. We will assess the September meeting. The clerk's office has been working with us. They've been on the phone call with us this whole time. And so they have been helping through the process. And so we are somewhat limited with how many of these types of meetings we're able to hold. So I did include September as our next meeting, but we'll be assessing that and providing more information to everybody.
All right, so thank you very much, and the meeting is now adjourned.
Thank you very much, everybody.
Thank you. See you all later. I got to see you.
Next time I
Bye.
want to see you, Mary.
Hey.
Bye.